Hi guys, just done a workout and I was thinking about a case I did with someone this morning about someone who's trying to counsel a patient to increase their exercise levels. They had some chronic condition and they're trying to bring exercise in as part of the guidance in the second half of the consultation. Something that of course you need to do. But one thing they found difficult was that they were just talking about guidelines. They were talking about what NICE suggests in terms of 30 minutes, 5 times a week. Of course we need to know those things. We need to let patients be aware of what the national guidance is. But it's really important sometimes to try and bring it in context of that person's life. You can just talk about these rules, but sometimes patients have legitimate reasons as to why it's difficult to do this. They may have time issues, they may have financial issues, they may want to spend what limited time they have with their family, work may be an issue. So the more things that you can find out, well, we've talked a lot about in our courses about healthcare counselling, about how to categorize carrot approach versus stick approach. But if you're thinking about exercise, then try and find out about their day, find out about their situation, find out about their life, and then you can start to tailor these things into a plan that works for that person. So for example, say someone says, oh doctor, I'm too busy. I've got 3-hour commutes every day. I'm flat out at work. I don't have time to join a gym or go for a run, all the normal stuff that you may be suggesting someone to do. So bring it into their life. Talk about, well, okay, you drive to work. Why don't you maybe park a mile away on a couple of days a week and walk a mile each time, walk a mile back each time. That way you get your exercise in, it's not interfering with your day, and you're still able to go to work. Ask how they go if they stay on the 14th floor, work on the 15th floor. How do they get up? If they live on the 14th or 15th floor, how do they get it? If they use a lift all the time, talk about, well, getting off at the 12th floor, for example, and walking 2 floors up. And then on the way down, walk 2 floors down and then get the lift down again. That way it's not interfering with your daily routine. That way you can spend the little time you have at home with your family and not wasting it going to the gym, for example. Some people talking about, again, family time. I don't have time to go to the gym. I've got 2 young kids. I don't want to miss them. I'm working so hard. How do I fit it all in? So talk about using the information that you have about kids being at home, for example, and working it into their exercise routine. So for example, asking, do they like bikes? Do they like getting outdoors? I don't know, doctor. Well, why don't you buy a bike? Why don't you sit a seat on the back and take them out twice a week? I'm sure they'll love it. Maybe they'll want to get into cycling as well. Again, make it a family thing rather than, oh, you need to go to the gym and do your exercise and all this kind of stuff that we tend to talk to people about and expect them to just make changes in what might be a really difficult situation. So remember, it's really important in data gathering, it's not just about finding out do you exercise or not. It's about finding out the logistics, the situation, the family life, the work life, so that you can tailor your plan to that particular person rather than just giving a list or a lecture of what the guidelines say. Of course, be aware of this stuff, bring it into it, but bring their own life into it as well. That's what a shared patient-centered management plan is all about. It's not just about knowing the medicine and showing off that you know all the rules and the guidelines. So find out about stuff in the first half. When you come against an obstacle, a healthcare thing, especially like exercise, find out their situation, find out about work, find out about home, do the hard work in the first half, so you bring it back in the second half and make it a bit easier for that person to get on board and work with you to come up with a plan that clearly is going to work for them in the future regarding their long-term medical condition. Heard this else? #CanPass, will pass, #I went with Arora.